Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. I really appreciate you joining us today. And as I always say, this is the second half of the Wednesday show, which is Singing River Health Talk. I really look forward to these conversations with these professionals, doctors and others who are involved in the Singing River health system. And today is no exception. I'm looking forward to having a conversation with Dr. Pete Avara. He's a general surgeon and bariatric surgeon. He's done more than 4,000 bariatric procedures at Singing River Health System. Dr. Avara, how are you doing, my friend?
Great. Thanks for having me.
Good to see you. We had to make some adjustments because you had surgery today. How's your day been? Been a good day?
Things drag on sometimes longer than we want.
Well, look, you're in an important area, and I think sometimes people think with the advent of new drugs that enable people to lose weight, that there's not a need for a bariatric surgeon anymore, but that's certainly not the case at all. You're dealing with obese scenarios. You're really helping people not just have better lives, but literally save their lives. Tell us more about the area that you're involved in.
Sure. So obesity is a common problem that everyone recognizes, but it's really devastating to people's health. And the greater your degree of obesity, the more severe the problem is and the longer it lasts. And so we really have to get folks to thinking about taking care of themselves. And whether you hate your weight because it's hurting your body or you don't like how you look, the answer, it's a medical problem, is to seek out adequate medical care. And we have the ability to treat this disease in all of its stages, really.
It's an incredible thing. Well, there's been this theme as I've talked to other doctors at Singing River Health System, and that is with 51% of Mississippians living in rural areas, it has a lot to do with culture, what we eat, where we come from, that we're not as aware of the relationship between what we eat and our lifestyles and obesity and ultimately health. So you're dealing with a lot of people who are really struggling to try to understand how they can get their lives back. And there's a psychological component to it. There's a diet component to it. In some cases, there's a surgical component to it. But you have to, in your world of work, you have to be willing to hit on a bunch of different cylinders. I mean, you really have to cover the spectrum with those patients, don't you?
Yeah, so this is a complicated disease. There's not a simple fix. Most folks have heard about the shots, the GLP-1s. They're powerful. Surgery clearly is the most powerful thing we have, but people need a program. We don't cure this disease. We just manage it, and we just have to stay on top of it. And our program, which involves doctors, nurses, physician assistants, nurse practitioners, dietitians, we really put a lot together to try to get folks on track. And it's a challenge because none of us really want to change how we eat, and we don't like to exercise. But we tell folks over and over again, if you don't have an exercise program, if you don't have some dietary guidelines, you're going to struggle mightily to get your weight under control and keep it there. And so it takes a team effort, but patients really have to want to get their weight under control, and it can be done.
I bet, if you look back on, over 4,000 procedures, you've seen the spectrum, those who had the surgery and had good intentions, but weren't willing to ultimately change their lives and fall back to wherever they might have been before. And you've seen great success where people's lives had literally been changed. They were willing to change their lifestyles, their eating, learn how to eat. A lot of people just don't know how to eat. They don't literally know how to eat, understanding calories in and calories out and the relationship, the importance of proteins and all these things, how they add up. You've seen tremendous success, haven't you?
Yes. And so you hit on a couple of good points. We really have a education problem in Mississippi, and Singing River has been looking at our community and where our problems are, and we're recognizing that how we communicate with people is so important, and sometimes we don't do it as well as we can. Treating this disease is an ongoing process, and I have seen folks who lost a couple of 100 pounds from their highest weight, and then they drift away and they come back a couple of years later and they've gained a bunch of it back. And we tell folks, it's just like, it's really like going to your dentist. You can't brush your teeth one time and be done. You got to keep flossing and brushing and getting it taken care of. And it's a little frustrating for patients, but it works. If you will let somebody who knows what they're doing help you stay on track with your diet, with exercise, with medication, and we're using a tremendous amount of pills and shots along with surgery, and the psychological component. It is complicated, and for the folks who think, well, I'll just push back some, that doesn't work. And we shouldn't shame people for having this disease. We really shouldn't, because we're all susceptible to it. The answer is to just address it pragmatically, and we can see great success.
And listen, if we're talking to someone who is morbidly obese, and we can actually define that, you can actually define that at the beginning, who's listening to this show now, the reality is they can't stay on the road that they're on. They're going to have a much shorter life. They're going to have their quality of life is not going to be where it needs to be. So talk a little bit about taking that first step and define morbidly obese.
So in Mississippi, basically half of us are either overweight or obese. And probably 1 in 6, 1 in 5 of Mississippians have morbid obesity. And that's that condition where your body weight is so great. And we recognize it. My grandchildren can recognize morbid obesity. This is killing people. It hurts their joints. It affects the blood pressure. They get diabetes. They get more cancers. I mean, this is not a healthy state to be in. So what do people do? They try and they go off on their own. And what we tell folks is, if you will call us and let us, we have free seminars. We have a lot of information that you can just get on your computer. You don't have to get out of your house. But the path to getting healthy does involve doing some things and changing your lives. And if we can just encourage people to do that, we can change the trajectory in Mississippi. It's going to be a struggle, because we do have a lot of disease. But the answer is for people to call our Singing River Weight Loss Center, and we will get you started. And it's not dangerous. We're not going to do anything bad to you. And you hit it a while ago. So many people do not understand some of the physiology, and we're still learning. So if they'll talk to us and let us get our hands on them, we can make a difference.
You talked about your team. It's interesting because you're a member of a team. It takes a village to manage someone forward, even if they choose to have the surgery. The surgery in and of itself is not a solution by itself. It's just multifaceted tool. But tell me more about the team.
So we have several surgeons who are pretty much dedicated to bariatric surgery. That's what I've been doing for 25 years. We have our mid-level providers, nurse practitioners and physician's assistants, who have really good medical knowledge about the shots. And the shots are incredible. They're very powerful. They're very expensive. Some people have an insurance benefit. Unfortunately, so many people do not. But even if you can get the shot, you need help. You need better nutrition. We want to maintain your muscle mass. And the studies are telling us all the time that folks who get the shots, for instance, and don't do the right thing with their diet and exercise will lose muscle mass. They'll lose a lot of weight, but it's not healthy. And that's not what you want. We want to keep people in their best health, and that can be done. Just, it's not something that people should do without a lot of guidance and help.
Yeah, I had an interesting experience myself. I did my annual physical. I've always been extremely active, working out with weights and running and all those things, thinking, I'm doing great. And I had an annual physical this year. I'll be 68 this year. And my A1C came back a little high. And I was super surprised by it. And essentially saying that, if I don't correct that, I'm in a pre-diabetes, kind of area. And I started to focus on it. But even me, after all these years of thinking I'm eating well, and I really was eating well, maybe a little bit too much carbs. I don't eat sugary drinks. But as you get older, you lose the ability to process carbohydrates and sugars, as you know, and I'm sure you've had that conversation many times. Understanding the role of protein, I've really worked hard to get enough protein. Honestly, when you focus on it, you realize we're not getting enough protein. And the role that protein plays, especially as you're getting older, is hugely important, isn't it?
Bariatric surgeons, I think, were one of the first groups in the country to really start harping about increasing your protein intake. And you should come to work for us, because you're right, you're spot on. We want to get rid of the carbohydrates. We want people to be on a high protein diet. We're real big about protein supplements because they tend to have low calories and they can load a lot of protein. And for the lay people out there, protein is muscle. That's the stuff that makes us look good. That's what we want. And carbohydrates and fats just give us more fat. And so as we get people to trying to eat healthier, and it's hard to do. We live in South Mississippi, and I tell people my grandmother loved me, but what she wants me to eat is not what I should eat.
When we come back on the other side, we'll continue our conversation with Dr. Pete Avara at Singing River Medical Center, and we'll just continue this terrific conversation. We'll see you after this. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. This is Singing River Health Talk, and we're visiting with Dr. Pete Avara, who is a general and bariatric surgeon. He has performed over 4,000 bariatric surgeries since he started in this line of business. So he's had the opportunity to really see it all. I want to spend just a little bit of time on the nuts and bolts for a second about what qualifies someone for a weight loss surgery, and it gets into the BMI and other aspects. So talk to us a little bit about that.
Sure. BMI is a common metric that we kind of measure people's weight. And I think everybody should know their BMI. And you can find it. You just go to the internet, type in BMI, and a table will come up, or a calculator. And basically, you want your BMI to be less than 30. Nobody wants to be too skinny. We don't like that either. But if you can keep your BMI in the low 20s, that's a fantastic place to be. When your BMI is above 30, you have obesity. When you're above 35 and certainly above 40, you have morbid obesity, particularly if you have diabetes, hypertension, and what they call comorbid conditions. And everybody with a BMI above 40, and unfortunately there are just way too many of us, has a problem that needs medical treatment. And you're not going to get your weight under control and keep it under control, except under there are always rare exceptions, but the vast majority of us need professional help to make this work. And I think a BMI of 40 is a great cutoff for people and a place to look. So you should know your BMI. You should try to get it below 30. And if you can't get it below 30, you need help. And if your family doctor can't get you where you are, then you need to be referred to somebody that specializes in this, and that's what we do.
So there's several solutions. I was looking at this list: gastric sleeve surgery, there's bypass surgery. There's a lot that you bring to the table. Talk to us about that.
So for years and years, we had gastric bypass, and that may still be the mainstay of bariatric surgery. But about 15 years ago, sleeve gastrectomy, where we make the stomach smaller, we just kind of take off the side of the stomach and turn it into a tube, and you can't eat as much. And it has proven to be wildly successful and easily accomplished, and we get great results. But we tell people every day, surgery, nor the shots, nor any other single one-time solution is going to fix this problem. You need help, you need treatment, and whether it be drugs, surgery, et cetera. And you have to do the foundational things, and you got to change your diet, and you have to have some physical activity that ramps up your metabolism. It's not difficult to do. We just struggle getting people to buy into it over the long term. You were doing that, and you're controlling your weight, and good for you. We just need more of that.
What did it for me is, a history of cardiovascular disease in my family, and I like to hunt and fish and want to be able to enjoy doing strenuous things. And I made a commitment. It was back in 1980. I made a commitment, and I have stayed with it ever since then. It's been a long history of doing it. But
I have lots of folks who come to us, and they tell us that they just want to be able to go to Disney World. They just want to be able to get in their boat. And when obesity has attacked you and done this to your body, you got to get this fixed. And sister-in-law's advice is not going to be good enough. You really, if you have diabetes, like you said, your A1C is up, you're going to see somebody help you make that better because you know the results. And obesity is just the same way. If you don't get that under control, your body will pay a tremendous price. You will not live as long as you need to. You won't be able to enjoy the life that you have. And it's not necessary to live with obesity. This can be conquered.
Yeah, I bet the most successful patients you have a view of them being able to play with their grandkids or have a different role in their kids' lives where they're more active. When you have a goal that's very crystal like that, I bet you have more success.
So it is difficult sometimes for people to see the big picture, and young people, of which I think I was at one time, I didn't have a big long range picture. But as we get older, we realize how important it is to keep ourselves able to get to be 68 and be in pretty good health. And so the folks who really want to get their weight under control and are willing, it's not Herculean. We know we're not asking anybody to do things that are out of reason, but you do have to follow through. And I tell folks, you're not going to get your weight under control sitting on the couch. That's not going to ever work.
So you mentioned the free no commitment 24/7 webinar. You can call the Singing River Weight Loss Center or singingriverweightloss.com, or you can dial 228-872-7277, 228-872-72877 to get access to that free webinar so you can learn more about what Singing River is all up to. But hey, is there anything we got less than a minute left? Anything you want to say before we get done?
No, other than I want people to think about their health. And if you have a problem with your weight, you want to deal with that. And the answer is, we're not ever going to shame you. We're never going to give you a hard time. We're going to give you some options and some solutions. And if you will follow through, we'll help you get your weight under control. Yeah,
this has been a terrific conversation. It's been Dr. Pete Avara, who is a general and bariatric surgeon at Singing River Health System. This has been Singing River Health Talk. It's been a pleasure to spend some time with you, Doc.
Thanks very much. Enjoyed it.
You bet. It's been terrific. Listen, have a great day, and we will see you tomorrow.